আমার কাছে যেই অ্যান্সার কি কোশ্চেন কিটা আছে সেট নম্বর 3, অ্যাকর্ডিং টু সেট নম্বর 3 ওয়াইজ যে অ্যান্সার কি পাবলিশ হয়েছে সেটা আপনাদের বলছি, সেটা একটু মিলিয়ে নেবেন। কোশ্চেন নম্বর 1, হুইচ অফ দ্য ফলোইং ফুড এনহ্যান্সেস অফ দ্য অ্যাবজর্পশন অফ অ্যান আয়রন সাপ্লিমেন্ট? অপশন এ ব্যাকড পটেটো, অপশন বি অরেঞ্জ জুস, অপশন সি গ্রিন বিনস, অপশন ডি ফর্টিফাইড মিল্ক। কারেক্ট অ্যান্সার ইজ অপশন বি, orange juice. Question number 2, which of the following drugs is an example of proton pump inhibitor? Option A pantoprazole, option B famotidine, option C ranitidine, option D sucralfate. Correct answer is option A pantoprazole. Then question number 3, the side effect of nitroglycerin is option A vomiting, option B diarrhea, option C headache, option D constipation. Correct answer is option C headache. Question number 4, one of the following is not a live attenuated vaccine? Option A BCG, option B oral polio, option C measles, option D diphtheria. Correct answer is option D diphtheria. Question number 5, the most common causative organism of gas gangrene is option A Clostridium tetani, option B Clostridium botulism, option C Clostridium perfringens, option D Corynebacterium. The correct answer is option C Clostridium perfringens. Question number 6, the temperature that allows for most rapid growth during a short period of time is known as option A minimum temperature, option B maximum temperature, option C optimum temperature, option D growth temperature. Correct answer is option C optimum temperature. Question number 7, which of the following immunity is obtained during a lifetime? Option A acquired immunity, option B active immunity, option B C passive immunity, option D none of the above. Option is answer is option A acquired immunity. Question number 8, best indicator of HIV prognosis? Option A CD4 T cell count, option B CD8 T cell count, option C HIV RNA, option D ELISA. Correct answer is option A CD4 T cell count. Question number 9, which of the following aminoglycoside antibiotic has the broadest spectrum of antibacterial action? Option A amikacin, option B gentamicin, option C neomycin, option D streptomycin. Correct answer is option A amikacin. Then question number 10, the most effective method of killing microorganism is option A high temperature, low temperature, option C high temperature and high moisturizer, option D low temperature and high moisturizer. The correct answer is option C high temperature and high moisturizer. Question number 11, immunity produced in the body after exposed to long pathogen, live pathogen is called option A active natural immunity, option B passive natural immunity, option C active artificial immunity, option D passive artificial immunity. Correct answer is option A active natural immunity. Question number 12, in human body vitamin A is stored in option A liver, option B pancreas, option C spleen, option D stomach. Correct answer is option A liver. Question number 13, which of the following are the example of polysaccharide? Option A cellulose glucose sucrose, option B cellulose starch glucose, option C glycogen starch lactose, option D cellulose starch glycogen. Correct answer is option D cellulose starch glycogen. Question number 14, adult BMR decrease with increase of the following? Option A body fat mass, option B fever, option C body surface area, option D measles. Correct answer is option C body surface area. Question number 15, horny or toad skin is due to deficiency of option A proteins, option B essential fatty acid, option C carbohydrate, option D essential mineral. Correct answer is essential fatty acid, option B. Question number 16, when a particular antigen is mixed with antibody in the presence of an electrolyte at the suitable temperature and pH, the particle are clumped, this is called option A precipitation, option B agglutination, option C electrophoresis, option D cataphoresis. The correct answer is option B agglutination. Question number 17, immunoglobulin is associated with anaphylactic delayed hypersensitivity reaction. Option A IgE, option B IgA, option C IgD, option D IgM. Correct answer is option A IgE. Question number 18, histamine exert is effect during inflammation by option A vasoconstriction of post capillary sphincter, option B constriction of large arteries, option C acting on H2 receptor on mast cell, option D causing venular endothelial contraction. The correct answer is option D causing venular endothelial contraction. Question number 19, biological barriers include all except option A renal tubules, option B seal membrane, option C capillary walls, option D placenta. Correct answer is option A renal tubules. Question number 20, half life does not depends on option A biotransformation, option B time of drug absorption, option C concentration of a drug in plasma, option D rate of drug elimination. Correct answer is option B time of drug absorption. Question number 21. Generalized edema result from all of the following disorders except option A systemic hypertension, option B CCF, option C cirrhosis, option D nephrotic syndrome. Correct answer is option A systemic hypertension. Question number 22. Pharmacodynamics involves the study of following except option A biological and therapeutic effect of drug, option B absorption and distribution of drug, option C mechanism of drug action, option D drug interaction. Correct answer is option B absorption and distribution of drug. Question number 23. Disorders that predispose to thrombosis include all of the following except option A pancreatic cancer, option B pregnancy, option C vitamin K deficiency, option D sickle cell anemia. Correct answer is option C vitamin K deficiency. Question number 24. Which of the following nutrition component is not included in the ICDS program? Option A supplementary nutrition, option B vitamin A prophylaxis, option C iron and folic acid distribution, option D prophylaxis against vitamin D deficiency. Correct answer is option D prophylaxis against vitamin D deficiency. Question number 25. Triangular purely white and yellowish foamy spot on the bulbar conjunctiva on either side of cornea is known as option A keratomalacia, option B bead spot, option C corneal xerosis, option D conjunctival xerosis. Correct answer option B bead spot. Then question number 26. Which of the following muscular valve control the flows of digestive juice from hepatopancreatic duct to duodenum? Option A sphincter of Oddi, option B semilunar valve, option C ileocecal valve, option D pyloric sphincter. Correct answer is option A sphincter of Oddi. Question number 27. Which of the following organ is known as the graveyard of RBC? Option A kidney, option B liver, option C spleen, option D gallbladder. Correct answer is option C spleen. Question number 28. Which of the following is a part of hindbrain? Option A cerebellum, option B corpus callosum, option C hypothalamus, option C option D spinal cord. Correct answer is cerebellum. Option A. Question number 29. Which of the hormone is made by the posterior pituitary? Option A FSH, option B LH, option C ACTH, option D ADH. Correct answer is option D ADH. Question number 30. Which of the following is not a mechanism of child socialization in the family? Option A praise and blame, option B observing and learning, option C reward and punishment, option D study of scriptures. The correct answer is option D study of scriptures. Question number 31. Which respect to a movie loving high school girl a filmmaster from part of her? Option A secondary group, option B reference group, option C primary group, option D in group. Correct answer is option B reference group, option B. The question number 32. Family formed after marriage is called option A family of recreation, option B monogamous family, option C family of orientation, option D family of procreation. The correct answer is option D family of procreation. The smallest bone in our body is option A malleus, option B stapes, option C incus, option D nasal bone. Correct answer is option B stapes. Question number 34. The light sensitive part of eye is called option A choroid, option B sclera, option C retina, option D lens. Correct answer is option C retina. Question number 35. The formula A for calculating IQ is as follows. Option A chronological age by mental age into 100, option B mental age by chronological age into 100, option C mental age plus 100 by chronological age, option D chronological age plus 100 by mental age. Correct answer is option B mental age by chronological age into 100. Question number 36. Which part of the brain responsible for behavioral and emotional response? Option A pons, option B cerebellum, option C limbic system, option D medulla. Correct answer is option C limbic system. Question number 37. In the theory of repression, forgetting result due to option A when previous learning competes with new learning, option B pushing unpleasant memories into unconscious, option C decay of memory trace, option D inadequate practice. The correct answer is option B pushing unpleasant memories into unconscious. Question number 38. The maximum effect of a drug is defined by option A therapeutic index, option B potency, option C efficacy, option D adversity. The correct answer is option C efficacy. Question number 39. A social norm is option A what everyone adheres to, option B an evaluation of the state of affairs, a good or bad, option C a belief in something as good or desirable, option D is not adhered to by everyone by guides the action of individual in social interaction. The correct answer option D is not fair to by everyone but guides the action of individual in social interaction. Question number 40. Rajesh performed poorly in college exam and is angry of his professor for failing him. He then comes home and served lunch by his mother. He then screams at her mother for overcooking the rice and sabji being oversalted. What kind of defense mechanism is operating over her? Option A, intellectualization. Option B, regression. Option C, rationalization. Option D, displacement. Correct answer is option D, displacement. Then next question, question number 41. A person has altering period of elation and depression. During elation he is full of energy, cheerful, and during depression he is silent, tired, and these symptoms are option A, cyclothymic personality. Option B, melancholic personality. Option C, hypomanic personality. Option D, schizoid personality. Correct answer is option A, cyclothymic personality. Question number 42. An individual is aware of the stimuli but he is trying to oppose this actively or passively. It is frequently expressed in form of mutism or refusal to food. The term is used for the motor activities. Option A, repetitious behavior. Option B, negativism. Option C, compulsion. Option D, automatic behavior. The correct answer is option B, negativism. Question number 43. Which is not a commonly symptoms of depression? Option A, delusion. Option B, leprosy. Option C, insomnia. Option D, poor appetite. Correct answer is option A, delusion. Question number 44. Constant feeling of fear and apprehension is diagnosed as option A, hypomanic episode. Option B, impulsivity. Option C, anxiety. Option D, depression. Correct answer is option C, anxiety. Question number 45. Psychotropic medication that block the acetylcholine receptor may result one of the following side effects. Option A, dry mouth. Option B, sexual dysfunction. Option C, nausea. Option D, priapism. The correct answer is option A, dry mouth. Question number 46. Chasing the dragon refers to the smoking of option A, nicotine. Option B, heroin. Option C, hashish. Option D, bhang. The correct answer is option B, heroin. Question number 47. People with schizophrenia who has thought disorder, hallucination, and delusion are said to be option A, intrusive symptom. Option B, negative symptoms. Option C, extrusive symptoms. Option D, passive symptom. The correct answer is option D, positive symptoms. Question number 48. Base parameter for estimation of fetal age by ultrasound in third trimester. Option is female length. Option B, BPD. Option C, abdominal circumference. Option D, chest circumference. The correct answer is option A, female length. Question number 49. Hyperemesis gravidarum may occur because of excess estrogen, progesterone. Option C, HCG. Option D, oxytocin. The correct answer is HCG. Question number 50. The clinical entity where the process of abortion has started but has not progressed to a state from which recovery is not possible is option A, threatened abortion. Option B, inhibited abortion. Option C, missed abortion. Option D, complete abortion. According to answer sheet, option B, inevitable abortion is present here, but right answer is threatened abortion according to DC Dotto. Question number 51. Prolactin is released from the option A, anterior pituitary. Option B, posterior pituitary. Option C, ovary. Option D, adrenal gland. The correct answer is option A, anterior pituitary. Question number 52. Ascendant sign means option A, bluish discoloration of vagina. Option B, softening of cervix. Option C, pulsation felt in lateral vaginal furnace. Option D, fetal parts felt on abdominal examination. Correct answer is option C, pulsation felt in lateral vaginal furnace. Question number 53. Most common complication of ectopic pregnancy. Option A, pain. Option B, vaginal bleeding. Option C, infection. Option D, amenorrhea. Correct answer is option A, pain. Question number 54. Sign of magnesium sulfate toxicity include all of this except option A, respiratory rate less than 12 beats per minute. Option B, knee jerk absent. Option C, urinary output more than 30 ml per hour. Option D, serum magnesium level 4 to 7 MEq per liter. Correct answer is option C, urine output more than 30 ml per hour. Question number 55. In RH incompatibility, the color of amniotic fluid is option A, green color. Option B, golden color. Option C, dark color, dark brown. Option D, greenish yellow. The correct answer is option B, golden color. Question number 56. High level of maternal serum alpha fetoprotein indicate option A, fetal renal defect. Option B, cleft lip. Option C, neural tube defect. Option D, fetal cardiac defect. Correct answer is option C, neural tube defect. Question number 57. Which of the following is not the job of ASHA with reference to the NRHM? Option A, accompanying women to the health facility of antenatal checkup. Option B, using pregnancy test kit for early detection of pregnancy. Option C, providing information on nutrition and immunization. Option D, conducting the delivery of a baby. Option D is the correct answer. Conducting delivery of a baby. PMJY is acronym for option A Pradhan Mantri Jan Arogya Yojana, option B Pradhan Mantri Janani Arogya Yojana, option C Pradhan Mantri Jan Shastha Arogya Yojana, option C none of these. Correct answer is option A Pradhan Mantri Jan Arogya Yojana. Question number 59. Zero incidence is option A elimination of disease, option B eradication of disease, option C elimination of infection, option D eradication of infection. Correct answer is option A eradication of disease. Question number 60. Ideal time for copper T insertion is option A 4 to 5 days prior to menstruation, option B 7 days after menstruation, option C any time of menstrual period, option D 4 to 5 days of menstruation. The correct answer is option D 4 to 5 days of menstruation. Question number 61. Placenta previa is in which placenta completely cover the internal os is known as option A lower lying placenta previa, option B central placenta previa, option C marginal placenta previa, option D partial placenta previa. The correct answer is option B central placenta previa. Question number 62. Which of the zoonotic disease, option A hereditary cyst, option B malaria, option C filariasis, option D dengue fever. The correct answer is option A hereditary cyst. Question number 63. Sample registration system is done once in option A 6 months, option B 1 year, option C 3 months, option D 2 years. The correct answer is option A 6 months. Question number 64. Pentavalent vaccine should be administered, option A after 6 weeks and less than 1 year, option B within 6 weeks, option C after 6 months to 3 years, option D at birth. Correct answer is option A after 6 weeks and less than 1 year. The next question, the headquarter of UNICEF is to option A Paris, option B Geneva, option C Rome, option D New York. The correct answer is option D New York. Question number 63. Yersinia bronchiectasis is the causative organism of option A Calager, option B Filaria, option C leprosy, option D none of the above. Correct answer is option B Filaria. Question number 67. Vertical transmission refers to the mode of transmission of disease agent by the agency of option A placenta, option B blood transfusion, option C breast milk, option D A and C. Correct answer is option D A and C. Question number 68. The height of a child become double of his or her birth weight at the age of option A 1 year, option B 2 years, option C 3 years, option D 4 years. Correct answer is 4 years. Question number 69. First case come to notice physician is called option A primary case, option B index case, option C secondary case, option D refer case. Correct answer is option B index case. Question number 70. Pap smear is an example of option A primary level of prevention, option B secondary level of prevention, option C tertiary level of prevention, option D none of the above. Correct answer is option B secondary level of prevention. Then the question number 71. Alarm resistance and excursion are concepts related to option A health belief model, option B trans theoretical model, option C health promotional model, option D general adaptation syndrome. Correct answer is option D general adaptation syndrome. Then question number 72. Lactate ringer solution is integrated in option A hypovolemia, option B burns, option C lactic acidosis, option C fluid lost as bile or diarrhea. Correct answer option C lactic acidosis. Question number 73. Which of the following is considered as an example of intentional tort? Option A malpractice, option B negligence, option C breach of duty, option D false imprisonment. Correct answer D false imprisonment. Question number 74. Injection KCL is administered as option A IV bolus, option B short IV, option C fast IV infusion, option D slow IV infusion. Correct answer slow IV infusion. Question number 75. Rovis syndrome is positive in option A appendicitis, option B cholecystitis, option C meningitis, option D peritonitis. Correct answer option A appendicitis. Question number 76. How should you open airway of an unconscious patient with cervical injury? Option A head till and jaw thrust, option B head till and chin lift, option C jaw thrust, option D chin lift. Correct answer option C jaw thrust. Question number 77. The most preferred intramuscular injective site for children and infant is option A deltoid site, option B dorsogluteal site, option C ventogluteal site, option D vastus lateralis site. Correct answer option D vastus lateralis site. Then next question number 78. Mr. Oyon, age 54 years, with history of type 2 diabetes for 20 years, has been admitted to the hospital with chronic renal failure. When completing the initial assessment, which sign would indicate circulatory overload? কোন সাইন থেকে circulatory overload বুঝবো? Option A apprehension, poor tissue turgor and bradycardia, option B an increase in blood pressure, apprehension and shock, option C cool dry skin, gastric distension and pleural edema, option D weight gain, coughing and phlegm and jugular vein distension. Correct answer is option D weight gain, coughing of sputum and jugular vein distension. This question number 79. The most common serious complication of peritoneal dialysis is option A leakage, option B bleeding, option C peritonitis, option D triglyceridemia. The correct answer is option C peritonitis. Question number 80. Diabetes insipidus is caused by the deficiency of option A antidiuretic hormone, option B insulin, option C glucagon, option D renin. Correct answer is option A antidiuretic hormone. Question number 81. Carning sign is positive in option A appendicitis, option B cholecystitis, option C meningitis, option D peritonitis. Correct answer is option C meningitis. Question number 82. A client admitted to the hospital with subarachnoid hemorrhage has complained of severe headache, neutral rigidity and projectile vomiting. The nurse knows lumbar puncture should be contraindicated in this client because of option A vomiting continuous, option B intracranial pressure has increased, option C the client needs mechanical ventilation, option D blood is anticipated in the cerebrospinal fluid. The correct answer is option B intracranial pressure has increased. Question number 83. The removal of entire breast, pectoral, major and minor muscle and neck lymph nodes, which of the followed by skin grafting in a procedure called option A simple mastectomy, option B modified mastectomy, option C radical mastectomy, option D modified radical mastectomy. The correct answer is option C radical mastectomy. Then question number 84. Pilocarpine 0.0 to 5% drops are indicated in the treatment option A acute iritis, option B acute uveitis, option C cataract, option D glaucoma. The correct answer is option C glaucoma. Question number 85. Very low birth weight baby whose birth weight is option A 1000 gram, option B less than 1500 gram, option C more than 1500 gram, option D 2000 gram. Correct answer option B less than 1500. Question number 86. What is the normal body temperature of newborn? Option A 36.5 to 37.5 degrees centigrade, option B 35 to 37 degrees centigrade, option C 36 to 37 degrees centigrade, option D 36.5 to 38.5 degrees centigrade. The correct answer is option A 36.5 to 37.5 degrees centigrade. TOF, tracheoesophageal fistula, is combination of all of the following except option A VSD, option B right ventricular hypertrophy, option C overriding of aorta, option D patent ductus arteriosus. The correct answer option D patent ductus arteriosus. Question number 88. First dose of vitamin A oil supplement is the infant should be option A 1 lakh unit, option B 2 lakh, option C 3 lakh units, option D 4 lakh. The correct answer is option A 1 lakh units. Question number 89. Quinsy means option A peritonsillary abscess, option B lung abscess, option C tonsillitis, option D pharyngitis. Correct answer is option A peritonsillar abscess. Question number 90. Sharp diaphragmatic abdominal thrust performed to clear airway obstruction in the patient without ventilation is termed as option A Leopold maneuver, option B Placos maneuver, option C Helming's maneuver, option D Valsalva maneuver. Correct answer is option C Helming's maneuver. Question number 91. An 18 years old is admitted in ICU with head injury, following which medication will be administered to him to prevent the development of cerebral edema? Option A Lasix, option B mannitol, option C aminophylline, option D all of the above. Correct answer is option B mannitol. Question number 92. Which of the following is not seen in nephrotic syndrome? A option A edema, option B peritonia, option A proteinuria, option C hypoproteinemia, option D hypocholesteremia. The correct answer is option D hypocholesteremia. Question number 93. Kwashiorkor triads includes all except option A psychomotor change, option B hypoglycemia, option C edema, option D growth retardation. Correct answer is option B hypoglycemia. Question number 94. Anterior fontanelle closure, option A 2 to 3 months, option B 4 to 7 months, option C 9 to 12 months, option D 18 to 24 months. Correct answer is option D 18 to 24 months. 95. Question number. Emotional release or discharge after recalling a painful experience, option A ambivalence, option B apathy, option C affect, option D abstraction. Correct answer option D abstraction. The question number 96. Inability to have goal directed association of thought, option A circumstantiality, option B incoherence, option C tangentiality, option D phobia. Correct answer is tangentiality. Question number 97. Therapeutic level of blood lithium is option A more than 2 MEq per liter, question number option B 0.8 to 1.2 MEq per liter, Option C 0.6 to 1.2 MEQ per liter. Option D 1.4 to 2 MEQ per liter. Right answer is option C 0.6 to 1.2 MEQ per liter. Then question number 98. Autism mainly involve option A overactivity and interaction. Option B poor eating skill. Option C poor intelligence. Option D poor communication. Correct answer is option D poor communication. Question number 99. By dexterous reach achieved at the age of option A 2 month, option B 6 month, option C 4 month, option D 9 month. Correct answer option C 4 month. Question number 100. Scarlet fever occurs due to option A group A beta hemolytic streptococcus infection, option B streptococcus aureus infection, option C streptococcus pneumoniae infection, option D enterococcus infection. The correct answer is option A group A beta hemolytic streptococcus infection. Thank you guys.